Greetings everyone, I am Joseph Michael Sagrado, and for this video, we will be imparting to you some knowledge about the muscular system. So, without further ado, let's have Ms. Rosalejos as she define what the muscular system is.
As you may all know, the muscular system is responsible for body movement as well as maintaining posture and blood circulation throughout the body. So muscle cells, contractile elements, and connective tissues make up the structure. The muscular system also has three types of muscle: the skeletal, smooth, and cardiac. Here are the charts of an organ and its corresponding functions. The skeletal muscles, for example, provide skeletal movement as well as control the entrances and the exits of the digestive tract. Axial muscles, from the other hand, support and position the axial skeleton. The third are the appendicular muscles. They support, move, and brace the limbs. Lastly, there are tendons and aponeurosis. They use contraction forces to perform specific tasks. The difference between the two is that aponeurosis connects the body's muscles to other muscles that require assistance, whereas tendons serve as a link between the muscles and the bones.
Muscle tissues. A fun fact about muscle tissue is that it has the ability to shorten or contract in order to cause body parts to move. This ability is what made it unique. The muscle tissue is made by a densely packed cells and a good supply of blood vessels. There are three main types of muscle tissue. First is the skeletal muscle. Second, the smooth muscle. And third is the cardiac muscle.
The skeletal muscle. It is also known as voluntary muscles as they are used voluntarily. As the name suggests, skeletal muscle is connected to the skeleton, either to the bones or connective tissue such as our ligaments. They can control their motions at will and as striated muscles. Striated muscles are highly organized tissues that convert chemical energy to physical work. Muscles are usually connected to one another in two or more places. When muscles contracts, the attachment points pulled closer together. When it relaxes, the attachment points moves apart.
The smooth muscles can be found in the walls of the body parts such as the airways, stomach, alimentary canal, and the blood vessels. Unlike the skeletal muscle, this type of muscle tissue is involuntarily, which means that it functions automatically. Here is how the smooth muscles look like under a microscope. The smooth muscles is also responsible for the transport of food through the digestive system, the control of the width of blood vessels, and the emptying of liquid from the bladder.
Lastly, the third type of muscle is known as the cardiac muscle, and as the name implies it is the muscle that found in our heart, and this is what composes the heart's wall. Fun fact, the cardiac muscle is part of both muscular system and circulatory system. It is in charge of transporting blood throughout the body, and it has its own pacemaker that ensures that it beats in time. Thank you.
Here are some facts about our muscles you might want to share with others. If strength is defined as our ability to exert pressure, then the masseter muscle is the strongest muscle in our body. This is most commonly referred to as our jaw muscle. You've probably heard of the word buttocks, right? The buttocks, or what is scientifically known as the gluteus maximus, is actually the largest muscle in the human body, located at the back of the hip. The smallest muscle, on the other hand, is a skeletal muscle called the stapedius muscle. This muscle is located inside our ears and plays an important role in otology, the study of the pathology of the ear. Its purpose is to stabilize the smallest bone in the body, which is the stapes or stirrup bone of the middle ear.
To further increase our knowledge on the muscular system, here we have some common diseases of the muscular system, its symptoms, and how to prevent them. First, we have fibromyalgia. This is a condition that causes pain all over the body, causes sleep problems, fatigue, and often emotional and mental distress. Symptoms often begin after an event such as physical trauma, surgery, infection, or significant psychological stress. Its symptoms are depression or anxiety, lack of energy, trouble sleeping, muscle twitches or cramps, memory problems, and trouble concentrating. So here is how to prevent them. There is still no known cure for fibromyalgia, but in order to prevent it from happening to our body, we must maintain our healthy weight, stay active and exercise regularly, get enough sleep, eat a nutritious diet, minimize stress, manage arthritis, depression, or other conditions.
Polymyositis is inflammation of muscles and their associated tissues, including blood vessels. Polymyositis is mostly seen in people over age of 20, more often females. A person with this condition may experience falls and problem getting up from falls. Symptoms include dry cough, difficulty in swallowing, weight loss, trouble catching your breath, joint pain, and stiffness. Polymyositis is a chronic condition that means that once you have it, it sticks around. So you should ask your doctor for you to know the ways to manage it. The doctor will probably start you off with azathioprine or methotrexate. Physical therapy is also a possible way, as this will make you stronger and help you move better.
Myasthenia gravis. This is a chronic autoimmune disorder in which antibodies destroy the communication between nerves and muscle, resulting in weakness of the skeletal muscles. Symptoms of this disease includes trouble swallowing or pronouncing words, weakness of the neck or limbs, visual problems including drooping eyelids, orthosis and double vision or diplopia, muscle weakness and fatigue, and facial muscle involvement causing a mask-like appearance. There are no known ways to prevent myasthenia gravis, but if you already have the condition, take these steps to avoid making it worse. Try to prevent infections with careful hygiene and by avoiding sick people. Avoid overexertion. Learn effective methods of dealing with stress. Do not become overheated or too cold. Treat infections promptly. The last common disease in our list is rhabdomyolysis. This is a disease that causes the breakdown of skeletal muscle. This breakdown causes myoglobin release in the bloodstream. This dangerous muscle damage can result from overexertion, trauma, toxic substances, or disease. Some symptoms include muscle swelling, weak, tender, and sore muscle, dark urine that is brown, red, or tea-colored. Some people also experience dehydration or decreased urination, nausea, or loss of consciousness. You may not be able to prevent rhabdomyolysis that occurs as a result of an accident, but you can reduce your risk of developing exercise-induced rhabdomyolysis by starting an exercise program slowly. If you feel tired, stop and rest. Don't push yourself beyond safe limits. Staying hydrated and avoid getting overheated. Not abusing alcohol or taking illegal drugs. Talking to your doctor about any medication you're taking that may increase your risk of developing rhabdomyolysis. Be especially careful if you have diabetes or liver disease.
And that concludes our presentation on the muscular system. Hope you have learned more, and always keep in mind to keep our body healthy. We must have proper diet, proper exercise, and a good night's rest. So, that's all for this video. Hope you learned, and stay tuned for more.